Good evening. I'm going to wait on you all to join us, whether you're tuned in from Facebook or from our YouTube page. We're so glad that you have joined us on this evening, and I hope you would do us a favor as we're preparing to begin our town hall on this evening. Would you share this stream? Let the people in your network know that we are live right now on our Facebook page as well as our YouTube channel. Just take a moment, share on Facebook as well. Think about starting a watch party as we begin on this evening. And throughout this evening, if you have a question that comes to mind, I'm encouraging you to enter it into the comments section on YouTube or Facebook, and we will do our best within the time that is allotted on this evening to answer your question. Well, this is the day the Lord has made. We rejoice. We're so glad in it. I'm so glad that you've taken time to join us on this evening for our COVID-19 vaccine town hall. We felt it was important first to share that as a church, we do not give medical advice, and we encourage you to talk to your own physician. But we want it to be a resource for you to receive credible and reliable information from healthcare professionals who can help inform you as to the decision that you will make as to whether or not you will receive the vaccine. And so I'm so glad that you've taken time on this evening to join us. It's going to be a great discussion. And I don't want to take away from the time. I would be remiss if I didn't take a moment to do two things. One, to invite you to share with us, if you're not a member of Mississippi Boulevard, on a Sunday morning at 10:30 a.m. or Sunday afternoon at 4 p.m. for our online worship experience. We're in the midst of a series during Black History Month called Good Trouble. And so I invite you to share with us either at theboulevard.org, our Facebook page, or our YouTube channel. Before we get started on this evening, I want to take a moment and ask God to bless our time. Let us pray. Eternal and gracious God, we give you thanks and praise for bringing us to the evening in this day. Thank you for sustaining us and protecting us and providing for us. We thank you for the opportunity to connect digitally. Thank you for those who have been trained in healthcare and for the expertise they bring to this conversation. And we pray now, God, your blessings on this town hall. May it be informative. May it help to provide resourceful information that can be shared to help people make a wise decision concerning not only their health, but the health of our community in beating this pandemic. We lift tonight those who are grieving tonight the passing of their loved ones who have died because of COVID-19. We trust your word that tells us that you are near to the brokenhearted. And we pray, God, you would bless us on this evening. May all that is done bring glory unto your name. We ask these things in the strong name of Jesus. And the people of God said, amen. It gives me great pleasure to introduce our host for this evening, our beloved brother, Jeremy Pierre of Fox 13.
Good evening, everyone. Good evening, everyone. I want to thank Pastor Turner for asking me to be a part of tonight's town hall meeting, as well as I want to just thank the doctors, the healthcare professionals that are going to add great insight on the vaccine, information on the vaccine tonight. Thank you again, Pastor Turner. Real quick, I see on Facebook as well as YouTube, we have about 90 or so people viewing us on Facebook, as well as on YouTube. We see about 67. Please don't hesitate to share this information now, as Pastor Turner had said before. Please don't hesitate to share this information now. Share the link, start a watch party or whatnot. I guess it's time for us to introduce our panelists. Tonight, we're going to hear great information from Dr. Cassandra Washington. She's the Chief Medical Officer for Methodist Lebanon in Germantown, and also Dr. Lynette Washington of Credo. She's the Doctor of Pharmacy Practice. So we have some questions, and we're going to jump right into it. We're not going to keep you long tonight. Dr. Washington, Dr. Howard, good evening to you.
Good evening.
Good evening. So the first question we have on the floor: how does the COVID-19 vaccine work? I know a lot of people are wondering about that. I get questions about it all the time. How does it work? Like, I'm a doctor, right?
Right.
Y'all are the doctors. People
Yes.
want to know about the types of vaccines, the benefits of getting the vaccine. What does the vaccine consist of? 2 doses. I know a lot of people are hearing that the Johnson & Johnson only consists of 1 shot. Then we also heard of another vaccine that you could get 1 shot and then get another 3 months. It's a lot of information. So just take the floor and just tell us, how does this vaccine, this COVID-19 vaccine work?
Mm-hmm. Awesome. Well, good evening. I'm Dr. Cass Howard. As Jeremy mentioned, thank you for that. And my partner in crime is Dr. Lynette Washington. Jeremy, if we may, we have, some people are visual learners, and we have a few visual aids that might help that discussion and explanation for those very, very pertinent questions. Are we able to maybe go to the slides and we can educate our viewers quickly on just kind of a quick overview of the vaccine process? Okay, awesome. Love technology. All right, let's go on to the next slide. So again, Jeremy did our intros. We're very happy to be here. Next slide, please. All right, so February, we celebrate Black history and all the many contributions that we've made to our great country. And we would be remiss if we were to have a discussion about this life-saving vaccine process that we're going through, and we did not give props to Dr. Kizzy Corbett. She's an American virologist, an immunologist, and she's currently at the National Institutes of Health in Bethesda, Maryland. And Kizzy was one of the scientists partnered with her partner, Dr. Barry Graham. Those 2 in concert are actually credited for the scientific development of the technology that brought us these vaccines. So we felt it was definitely appropriate to just educate our viewers on Dr. Corbett's work and all that she's done to bring this vaccine to not only our community, but to all the Americans out there that hopefully will take this virus and benefit from the vaccine's protection. So next slide, please. Oops, go back. There we go. So Jeremy asked about the question about the differences in the vaccines that are out there. So this is a brief overview. The first product is the Moderna vaccine. It is a messenger RNA type of virus. And if you think of that, just think of a messenger carrying the code that our body can use to produce proteins to protect us from a future or subsequent infection with coronavirus. And this is one of the vaccines that has been approved under the emergency use authorization for patients age 18 and older. You can see that this trial contained over 43,000 participants across 6 countries, of which 10% were Black. That trial was successful, showing a 94% efficacy. Basically, to the layman, it tells you that there's a great likelihood, a strong possibility that this vaccine will protect you from severe infection, hospitalization, and death from COVID, the SARS-CoV. It is a 2-dose vaccine. You receive your first dose, and then 28 days later, you get your second dose. That's just the protocol that was approved to receive this virus, the vaccine for the virus, to receive this level of efficacy. As you've heard, the vaccines have different storage requirements. So the Moderna product is frozen. and it survives stable for 30 days under refrigeration. And once you thaw it to room temperature, you have to use the vaccine within 12 hours. So when you hear about us having to schedule patients and be very methodical about our immunization campaigns out in the community, there are some storage constraints that we have to work within. The Pfizer product also uses messenger RNA as the delivery method to introduce the protein to our bodies, and our bodies uses that messenger RNA to code for the protective antibodies that protect us from SARS-CoV-2, the COVID vaccine. It's approved under emergency use authorization for patients age 16 and older. You can see this trial also had more than 40,000 participants, of which 9% were Black. Again, 2 doses, they're given 21 days apart to receive 95% efficacy. And when we're talking efficacy, the endpoint is we want to prevent severe disease in the patient. We want you to avoid hospitalization, and we want to prevent death. This product has challenges because it has to be ultra frozen, and a lot of the distribution sites did not have an ultra cold freezer to achieve, negative 20-degree temperatures. It is stable 5 days under refrigeration. And once we thaw it to room temperature, we need to use it between 30 minutes and 2 hours. The third product, which you've heard a lot about in the media, is the Johnson & Johnson product. It uses a common virus known as adenovirus. Most of you know it as the common cold. And it uses the adenovirus to present the COVID proteins to our bodies so that we can produce our own natural antibodies to protect us against subsequent infection. I believe Johnson & Johnson submitted their request for emergency use approval last week. So we anticipate this product, if approved, to be available late February or early March. And this trial had approximately 43,000 participants across 8 different countries. The confusion here is you heard low numbers of efficacy or, down to 72%. But again, the goal is to prevent you from developing severe disease, hospitalization, or death. And this vaccine was 85% effective in doing that. The benefit of the J&J product is it's 1 dose. You get that level of effectiveness with just 1 shot versus 2, although a two dose model is currently being studied. And the other great benefit, especially for widespread community vaccination, is this product is stable under refrigeration for 3 months. So no freezing, no ultra cold storage. So that's why there's a lot of interest in Johnson & Johnson. The other question is, side effects. What should I expect? How will I feel after being vaccinated? So this is a, quote, shot in the arm, as you would a flu shot. You may have some local pain, swelling, or redness at the site. That's self-limiting for the most part. It's going to go away in a couple of days. I got my shot. It was a little sore, reminded me I got, injected with a needle. But by the end of the day, next morning, I kind of forgotten I've gotten it, and peeling the Band-Aid off was probably more painful than the residual pain I had. And then throughout the rest of the day, some patients complained of fever, chills, maybe feeling a little tired, and headache. Again, I got both shots, and other than some pain at the site of injection, nothing more than what I felt every year with my flu shot. It was very tolerable. So good overview of the 3 products we have available, and all are safe and effective. And this is what we'll be providing our community going forward. Next slide. So on the Tennessee Department of Health website, every day they update our status with immunizations, such as the COVID vaccination. So far, over 830,000 doses have been given. On Sunday, 340 were given. And you see over there to the right, 8.4% or more of the population statewide has received at least 1 dose. I think the startling statistic on this slide that's highlighted there in the red circle is the percent of Black Americans that have been vaccinated in Tennessee. And you see only 6.45% have been vaccinated, although we're 16% of the population in the state. compared to almost 70% of white Americans in Tennessee have been vaccinated. Now, some of that might be the fact of, the phasing of the vaccination process. We started off with, phase 1A1 and 1A2, which were healthcare workers, first responders, and in some of those professions, it's a predominantly, white profession. So there are more white physicians out there than Black physicians. So there was a little confounder there, but we have a long way to go with getting people of color vaccinated. You see there on the right, only 1.83% of Hispanic or Latino origin members of Tennessee have been vaccinated. So that's the purpose of tonight's event. We're hoping to educate our community, allay any myths or fears that you guys have about getting vaccinated. But we definitely want to see our immunization numbers go up in the minority community. Next slide.
I know the big question out there is, when am I eligible to get the vaccine and how do I sign up? Jeremy, I know you get that question all the time. So in Shelby County, you can go to shelby.community and you can actually see the different phase that we're in. So right now, currently in Shelby County, they are vaccinating healthcare workers, including the staff of healthcare centers, first responders, funeral and mortuary workers, and individuals over 70 years old. There are some other items out there as well, or people that are eligible, but it's important that you look at the Shelby.community, or you can even dial 901-222-SHOT and get that information. But the Shelby.community is going to be your source of truth for Shelby County residents. You can go there and find the information. I know hospitals, and Dr. Howard can speak more of this, are coming on board as well to start vaccinating more of the population. And then some healthcare offices are going to have access to the vaccine. Walmart recently, they published their website where you can go online and sign up. Again, you do have to meet the criteria of the phase that we're currently in to receive the vaccine. In Mississippi, their information or their requirement is a little bit different. They're currently vaccinating people that are 65 and older, and those that are 18 to 64 and have certain underlying health conditions. It's important that you, again, look at that particular website. Most recently, they've added some additional clinics in the rural area to help provide the vaccine. Again, who is going to be vaccinated and when is really going to depend on our allocation, both from the federal government, from the state, and how our population looks. Some of the communities around us have already started vaccinating the people that are 65 and older. Memphis looks a little bit different. We have a lot more population. We have a lot of older people in our community as well. And we just don't have the amount of vaccine that we need right now. It is coming, but it does have to be a phased approach. I also want to remind everybody, Jeremy, and if you can help us get the word out there, is to beware of scams. Our monies have already paid for the vaccine up front. So there is no cost to receive the vaccine. Now, as more and more pharmacies get the vaccine or get access to it, there may be an administration fee associated with it. But for the most part, there's not going to be a cost to the vaccine this year, and you cannot be denied access to the vaccine once it's available to your phase.
And, Dr. Washington, just to hit on that, beware of scams. I'm going to be honest with you, a lot of people are feeling so scared to the point where they want the vaccine, but they just don't meet the criteria, but they're willing to pay anything just to get a shot.
Right. So remember, the vaccine requires a particular storage, right? Ultra cold or freezer. So just think about that coming to you. It's not going to be something that's readily available. It also requires a clinician to pull up that particular amount in the syringe and then a trained individual to deliver that shot.
Yeah.
All right. Look, we have another question. We're going to talk about vaccine safety. Did we go through all the slides right here?
We have a couple. We have a few more. So if you go to the next slide, this just looks at the phases. Again, every phase is going to be different. We have a recommendation from the FDA or from the CDC that says this is the phase approach. But once it makes it to the state has the ability to adjust that. Again, looking at their age population as well as the risk-based population. So that's why you will see a difference from the CDC recommendations, from the state, and then even down to the county recommendations. So there are going to be 3 different phases that you look at. Next slide. And just real quick, I wanted to take you through the Shelby County Health Department website of where you can go sign up. I will tell you, I did check earlier today, and there were no slots available right now to sign up. But and the information that's out there right now is not easy to sign up. They're using Sign Up Genius, but later this week, they're going to be using a new platform. So hopefully it will be easier for our seniors to sign up. So once you go to shelby.community, you'll get this screen. And what you'll need to do is scroll down. So if you go to the next slide, you will see some options. You want to make sure you select the right appointment. So either your first dose or your second dose. Pay very close attention to that because it's going to be, they're going to have specific sites associated with that. So once you figure out if you're going to get your first dose or second dose, you would select that information. So select the right link. Also, do not mix shots. If you get the Pfizer vaccine, you want to get the Pfizer vaccine the next time, or same thing with the Moderna. So try to make sure, and also try to stick with the same organization. Your site may change, but if you get your first vaccination from the Shelby County Health Department, you want to make sure that you go back to the Shelby County Health Department because they have shots that have been allocated for the first and second doses. Mm-hmm. Next slide. So then you're going to go and you're going to actually start to sign up. If you see slots full, that means that they do not have any available slots for you right now. If you see sign up, you actually want to click on sign up. And then if you go to the next slide, and then you will see some available times where you can sign up. I will tell you, at the very top, you see where it says 49 out of 50 slots that have been filled. I would not recommend that you try to click on that because by the time you put in all your information, that particular slot is going to be gone because you select the slot first and then you put in all your personal information. So it's a very tedious process. Like I said, the state is actually moving away from Sign Up Genius and they're going to go to a different platform later this week. Next slide. This is where you will complete all the information. So make sure you fill it out completely. Triple check your email address because that's where your confirmation will go. So you have to have your confirmation when you show up to get your vaccine. They will ask you for that. And also you want to make sure that you do not show up more than an hour before your appointment time. And some sites may have a different requirement. So make sure you check that before you go. Next slide. And this is what your confirmation will look like. So make sure that the first one is what lands you when you finish everything. That tells you you successfully signed up. And then the information on the right-hand side is what the email looks like once you receive it.
All right. All right. So we've showed people how to sign up. We show people the differences between the 3. And I know I also get this question a lot. Again, like I'm a doctor. Is it safe if a woman is pregnant or have underlying medical conditions? A lot of parents want to know, is it safe for children? And for those who have contracted the virus and have recovered from it, do I still need to get vaccinated?
Wow, all very good questions. Dr. Washington, you want me to tackle those?
So you can start and I'll come in.
All right. So for the pregnant patient, we get that.
And this is another good one. We just saw it pop up. If you have cancer, is it safe for you?
Right. So the universal answer for all of those questions, especially with patients that have unique health concerns, such as cancer or any other immunocompromised disease state or pregnancy, the recommendation is to consult your personal physician to assess your risk and benefits of receiving the vaccination. In general, it's safe, but there may be some nuances to that patient's individual condition. There are some things that you'll be asked when you present to get the vaccine. Have you been vaccinated within the past 14 days? That's an exclusion, right? Have you received monoclonal antibody or convalescent plasma? That's going to delay your vaccination. Are you actively infected with COVID? You wouldn't think you'd have to ask that question because you probably should be at home isolating and not in line giving everybody else COVID, right? So there are criteria, there's guidance out there with this emergency use authorization, but the safest and best advice for anybody with any pre-existing condition, including pregnancy, is to consult with your physician to assess your individual personal risk and benefits to being vaccinated before you sign up and before you present to be immunized. Dr. Washington?
I would say ditto. Please consult your healthcare team, whether that's your physician, your personal pharmacist that you have, your nurse practitioner. Please talk to them. I did see recently where the board of OBGYN has come out and said that it is safe, even though they did not do studies on pregnant or lactating mothers. They have come out and said the benefit outweighs the risk. And so they encourage people to get it. But again, like Dr. Cass said, you want to make sure that you talk to your physician before you make that decision.
Yes, discuss with your physician. Discuss with your physician. Another interesting question: can anyone with underlying conditions be vaccinated? Let's just clear that up, because I know we live in a community where heart disease is prominent. We live in a community where high blood pressure is prominent. We live in these communities where diabetes, the sugars, is definitely prominent. And I believe I even saw on CNN maybe Thursday or so that some people who contracted the virus even started getting diabetes. So someone with any type of underlying issues like that, just clear that up. Is it safe for them?
Yeah, so in general, those are not exclusions. Again, if there's something unique about that individual's healthcare or medical conditions, it's always good advice to consult your healthcare provider. But if you're predisposed, as my grandma would say, you got one foot on the banana peel, you'd probably want to socially isolate, wash your hands, wear your mask, and additionally protect yourself by getting vaccinated. So again, this is just another tool in the toolkit. We don't have a lot other than the social behaviors. So this is a great opportunity to arm yourself with the ability for your body to develop that immunity. One of your questions was, if you've had COVID, should you be vaccinated? The recommendation is that you get vaccinated. However, if you've had the infection, the recommendation is you can wait up to 90 days before you get immunized, because you should have some natural immunity. And we were actually doing that at my hospital when the supply was really short. People that had recently recovered kind of yielded to wait a bit and let those who had not had COVID or hadn't been vaccinated to receive those shots. So,
wow, that's good information. That's good information right there. Now, this is the most interesting conversation we're probably gonna have tonight. We're gonna talk about some myths. Some myths. We all know we all know they're there.
Yeah.
Yeah, we do. And that's why we're here, Jeremy, right? We want to make sure that we open up and we share as much information that we can so that we dispel all of those myths.
Right. But you know how our cousins are. Don't open that umbrella in the house. That's bad luck. No, look at that black cat walking in. But and the historical myths, I'm sure we all learned in elementary school about the Tuskegee experiment, and understanding that we got to understand that there are myths out there, and I know a lot of our cousins have said, "No, I'm not getting that because I love me." But if you really love you, might won't get it. Right. So, the vaccine will give you the virus. Is that that's one of the myths. Obviously, it's like a flu shot. I believe in the flu shot, you get some type of immunity to it, right?
Right.
Right.
The vaccine will affect my genetic code. That's some 007 type stuff. Right. The vaccine is for the elderly and the healthy people. The vaccine does not provide long-term immunity.
So I'll take a stab at a couple of those, and then I'll let Dr. Howard jump in first. So the first part, I'm going to take the last question first about it does not provide long-term immunity. The fact that this is it was approved under the emergency use authorization, we don't know how long it lasts. The studies are still ongoing. We believe that it is a year or longer, but those studies are still going. The people that were in the initial trials or studies, they're still being followed. So that information, the question out there is, the answer is we don't know how long it lasts. There is some, like I said, there's some information right now that it could last at least a year. The next piece of that around, it's going to give you COVID, the virus itself. And Dr. Howard has already touched on that. It does not, right? With the messenger RNA and also with the Johnson & Johnson product, it's going to make your body think that you have COVID because it builds a protein, and then the protein is going to be there, and then there are going to be the antibodies that fight off the protein that looks like COVID. And so that's going to fight it off. And when we talk about the Tuskegee experiment, and I know Dr. Howard can expound on this as well, the myth was that our brothers and sisters were injected with syphilis. And if we go back and we actually look at the research, they were not injected with syphilis, but they were actually withheld treatment. They were not given treatment. So they were thinking that they were going to be cured or get access to the drug penicillin. And in this case, they were not given access to the product.
Mm-hmm. Yes. And I'd like to piggyback on that. So, in medicine, one of the biggest complaints is, the haves and the have-nots. And this is one of the first situations as a physician of over 20 years where I've had the privilege of being able to provide a life-saving therapy to anyone willing or interested in receiving it, irrespective of your ability to pay, your socioeconomic status, what insurance do you have? Your cousin may say, yeah, I don't have the good insurance, or you have the good insurance, you can get it. There are no barriers to receiving this life-saving product other than, like you said, Jeremy, someone believing in a myth that hinders their decision to accept the therapy. I'm a physician. I went to Howard University. I've heard all the conspiracy theories, and I accepted my vaccine as soon as I could get it. And I got my second shot last week. I had family members that were naysayers, and they were, just misinformed. I mean, that's the only way I could explain it. But I committed to my family, just as I'm doing tonight, to help educate. And then that's all we can do, right? We can educate, we can share the truth as we know it to be. Guys, this is the first time we're dealing with SARS-CoV-2, coronavirus 2019. So we're learning, and as we learn more, we're adapting. But I can tell you with absolute certainty, your risks are far, far higher of severe disease, hospitalization, and death without any antibody protection than it is without it. It does say that.
And honestly, I think people try to and I think that's where we mess up a lot, comparing it to the flu shot, because the flu season comes around. We know, we got to get a flu shot, but we don't know what season this is going. This COVID-19. Oh, it's COVID-19 season. We gotta get that vaccine.
Yeah.
You know, I think that's one of the questions a lot of people like. How often do I get it? Do I get it every year? Do I get it every 6 months? You know, and going back into that efficiency. You know what I'm saying? How efficient the efficiency. How efficient is the vaccine? You hear me making up words and stuff.
Right. Efficiency. One's in the lab, one's in the body, but we won't hold it against you. But you bring up the flu shot, right? No one questions the need for a flu shot every year, right? We've accepted that influenza, they're variants, they're strains. Any virologist will tell you viruses mutate and they change, right? Someone asked in the chat about the variants. Will the vaccine I get today be effective against any of the variants that are out there? And again, we're learning, right? The initial study suggests that, the European variant, all but maybe the African variant, they're thinking this vaccine, the ones that are approved now, will convey some degree of immunity. Again, no one's promising you that you won't have nausea, vomiting, or get a low-grade temp. What we're asking is you to consider the protective benefit of the vaccine to prevent severe disease, hospitalization, and potentially death, of which a disproportionate number of brown people are dying from. So don't come back and look for Dr. Washington or myself and you say, well, you told me I wasn't going to get corona, right? You might get corona, but you have a greater chance of it not killing you, right? So that's the efficacy they're talking about, the 94%, the 95%. When you compare death versus an 85% chance of life, the J&J product doesn't look so bad, right? So that's what we want. We don't want folks to get lost in the science as far as having to choose with which product. If there's a product available in your area, it's more beneficial than having nothing.
Right, because first of all, you don't want people getting too lost into the myths or into the science, because then you get full of all types of things. I even heard people sitting at home saying they're not getting the vaccine because they're taking elderberry and sea moss. No, don't get me wrong, that'll help the immune system, but it ain't gonna keep you from getting that Rona.
It sounds like you already have your degree, Jeremy.
University. So. But there you go with that. But
I do see some additional questions in the chat.
Yes, we've been getting a whole lot of questions.
Do you still wear a mask after you get the shot, Dr. Howard?
Please wear a mask to your shot, after your shot, and even after your 2 weeks after your second shot, where you got your 94, 95, 85% efficacy. Please wear a mask. Please wash your hands. Please socially distance. The vaccine doesn't prevent transmission. So not only do we need to continue to decrease the transmission rates, do me a favor and keep the hospitalizations down just a little longer so we can catch up.
Would you call that one of the myths of this vaccine? I guess that because so many people say once I get vaccinated, the world for me is going to open back up. I can party and go back to living life as normal. Wouldn't you say that's one of the myths?
Well, yeah, it's definitely a myth. You have to remember, not everyone is going to get vaccinated at the same time that you receive yours, right? So, and children, right? The vaccines have not started in those less than 18 in some areas and 16 in other states. So we have to remember that children can still catch coronavirus. And like Dr. Howard said, the vaccines do not stop the transmission, which means that if you have it, you may not be as sick, right? But you can still, if you have it, you can still give it to someone else, and maybe they have not received the shot, and they can get severely sick and end up in the hospital and potentially death, which we don't want to have. So you still need to wear masks, wash your hands, and do all of that, and get tested, right? Still, tests are available. So if you feel sick, don't go get your vaccine. You know, you want to make sure that you're okay. So make sure you don't have coronavirus. So testing is still available. And then you can go get your shot after you're well.
Right. And look, it's okay to have a scare every now and then, because I'm gonna tell you, you two ladies, I had a scare, but I went to a restaurant where the food didn't have any taste. So right. I'm not gonna name the restaurant. No, we see right here. We got another interesting question. This is going back to what I just mentioned about the elderberry and building up the immune system. Would you recommend that we build our immune system up with vitamins and etc. before taking the vaccine? Does that have any effect on it?
I can take a stab at that. There are some studies out there that, you know, vitamin D will help you protect you against having severe cases of coronavirus. You know, if I take vitamin C, it's going to build my immunity up. What I always recommend before anyone starts any type of supplement is to talk to your healthcare provider. Mm-hmm. You want to get your labs. You want to see what your current labs are before you start taking different supplements. So I would defer to their healthcare provider.
Right.
Real quick, I did see, if you haven't noticed, I watch a lot of CNN. On CNN, that people that had a real tough time with the coronavirus, they lack vitamin D. Mm-hmm. And maybe you can explain I know what vitamin D is, but for the people that don't understand the importance of vitamin D, and we know vitamin C is for the immune system, but just real quick, explain vitamin D, because it's all of them look like alphabets to me.
Which they are, right? So I mean, I guess without giving everyone like a nutrition and a scientific lesson, but you know, minerals and vitamins serve purposes in the body. They're part of, you know, processes for protein production. Like you mentioned, some help our immune system work effectively and do what it needs to do to protect us. If you think about vitamin D deficiency, you know, activation of vitamin D, one of the ways you do so is with sun exposure, right? And what do we do in the summer? We're not laying out and tanning. And then in the winter, we tend to cover up and hibernate, right? So it's not uncommon for pigmented people to have low vitamin D levels. So, you know, with the recommendation of your healthcare provider, they can, number one, measure your vitamin D level and see if that's a deficiency that needs supplementation. And then they can advise to you what level of supplementation is recommended. Unfortunately, what we do is if a little bit helps, we're going to overdo it and do a lot, right? And there are some hypervitaminosis syndromes, and there's some harmful side effects if you overdose or take too much of this stuff. And you may be on medications to where there's some supplements you shouldn't take, right? To where you could cause yourself harm. So it sounds like we're trying to drum up business for your primary care provider, but we really aren't. These are just, you know, very simple, safe recommendations so that we don't harm ourselves in trying to make ourselves better.
I mean, it's good to go to someone who best knows you.
Right.
Right. What the song say? No new friends. We're going to take one last question. No new doctors. How about that? From the audience, I think I like this one. I really like this one, especially since the current state that we have here in Shelby County with these schools. We don't know. It's up in the air if they're going to return to the classroom. But the question is, what is the likelihood that the vaccine will be mandatory to get children back in school as opposed to the social distancing? Y'all want to take a stab at that? I know.
So I'll give you one big overarching sentiment. So these vaccines are approved by the federal government under an emergency use authorization. So in general, if something has EUA approval, we do not mandate it. We cannot mandate it. I don't think the general sentiment in this country is to force someone, you know, tie you down and put a vaccine in you. I think we're trying to follow the science and be judicious with educating our community as we learn more about the protective measures we can take to curtail this virus and hopefully get it out of our community, we're making that available. So taxpayers have already paid for this virus, which is why, with the vaccine, which is why it's free. And, simple measures like wearing your mask, washing your hands, socially distancing, those are the things that are going to get us back to work, get us back to school, get us to the movies, get you to the Super Bowl, not in the form of a Jeremy Pierre cutout, but you'll be able to go in person. But and I'll yield to Dr. Washington as well, but I have not seen any studies or policies proposing making any of the vaccines mandatory.
And remember, there is a process to make the vaccines, so we would have to have a sufficient supply as well. So there's no mandate at this time. And remember also that the vaccines have not been studied sufficiently in children. So we still have a ways to go to finish those studies to show that they'll be safe and effective in children.
Mm-hmm.
Wow. I do want to get back to the questions that we already have. And what time is it? We are 46 minutes in. And this is interesting because I have a brother who's a healthcare provider, well, in healthcare, the healthcare profession. And he recently got the vaccine. And what's interesting is that a lot of people are talking about the soreness and the body aches that they get. That's expected. That you all mentioned that earlier tonight. But what is it people can do before taking the vaccine? What to do after taking the vaccine? After taking the vaccine, should I continue? Well, we already answered that. Yeah, that's obvious. Continue to wear your mask.
Right.
Continue to wear your mask.
A few things I'll start. So a few things that we can do is that we're asking people not to pre-medicate, which means don't take your acetaminophen, which is Tylenol, or ibuprofen before you actually go take the vaccine, for a couple reasons. One is we don't have sufficient studies to show what happens if you take it, if your body will respond sufficiently to the vaccine if you take beforehand. But most importantly, we don't want you to take those type of medicines before you get the vaccine because we don't want it to hide any symptoms that you may have. So if you have a fever, if you already have a headache or anything like that, if you take the medicine before the vaccine, it could hide those symptoms. And we want to make sure that you are, there's a 15-minute period that you wait, or 30 minutes, depending on if you've ever had a reaction to the vaccine before. There's a period that you wait after you get the shot, and that the medical personnel will observe you to make sure that you're doing okay. And so if you take those before your vaccine, there's a potential that you mask those and then you can go home and start having some of those symptoms. So we ask that you don't pre-medicate before you take the vaccine. We also ask that you hydrate. Make sure you drink plenty of water before you go take your vaccine. Also, if you do get arm soreness, so Dr. Howard had little arm soreness and that was it. So for me, my arm was severely sore. The first time I could barely lift it up. So some people say, it hurt like the flu vaccine. Mine hurt more like the tetanus shot. If you guys ever had a tetanus shot before, it was bad. That was the first time. Yes, Saturday, I got my second dose and I hydrated first. And I also came home and did some light cleaning and some arm curls to help with that. And the soreness was a lot better. Well, it was minimal. I did have some chills the first time that I took the vaccine, and I took and I had a headache, and I took 2 Tylenol after the fact when I realized that it was not going away. We're healthcare professionals, so we do things to the extreme. Either we don't take anything or we take too much. And so in this case, I finally realized that it was not going to subside on its own. So I took 2 Tylenol and went to bed, woke up, and I was fine. This weekend, I was really tired after I got my second dose. I had a little of a headache, no fever, no chills. It didn't require any medication, just a good nap. And so this morning when I got up, I was fine. I'm still here. It's been longer than 48 hours. So
Right. And Lynette, to that, someone asked the question, why are the symptoms or the reactions different? Why are the side effects different? One shot versus another, you versus myself. Everyone's different. But just understand, with any vaccination, the intent is not to infect you, but it's to present your body with some component of that organism, in this case, a virus. So present your body with a portion of the spike protein, just enough so that your body recognizes it as foreign and develops protective antibodies, so that the next time you see it, it stops it at the door, basically. You don't get sick, hopefully, at all. But if you do, it mitigates how sick you might become. And again, not sick enough to be hospitalized or possibly die from this. So if that mimicking works, and everybody's immune system is different, right? I get bitten by a mosquito. It's just an annoying little bump. My brother gets bitten and he has a big, huge knot on his arm, as if, he got hit by a bat. That's just how his body responds. So we're all different. And as Dr. Washington said, we don't want you to mask your symptoms by taking everything known to man before you get it. When you get your immunization, there'll be a little a website or a little QR code that you can scan, and it's for a program called vSafe, and it's administered, Lynette, by the CDC.
It is, yes.
And when I got my first shot, you go on and you log in, you create an ID, and then I put on there I got my first dose from Pfizer, of the Pfizer vaccination. And then every week or at a certain interval, it'll send me a text and ask me how I'm doing, and I can report my symptoms. It sent me a reminder when it was time to get my second vaccination. It sent me an update today to ask me how I was feeling, where I could report my symptoms. So I would highly recommend that for you as well. And there's good information and contact numbers, I think, on there if you needed to reach out to someone.
And the last thing I would add is, if you are not feeling well, please contact your healthcare provider. So after you get your shot, you waited your 15 or 30 minutes or whatever it is. If you get home and you are still not feeling well, please contact your healthcare provider. Mm-hmm. There's a difference between, having a side effect from getting the vaccine, that's your body's natural response, and then actually having what we call an anaphylactic reaction. That's when your face is going to swell, your throat is starting to swell. That's when you need to seek healthcare guidance at that point. But there's a difference in someone having those common side effects that we talked about before and having a true reaction. Those true reactions, they have occurred, but it's been a very small amount of people. But like Dr. Howard said, please sign up for the vSafe, because that's going to help as we keep collecting information. That's going to tell us how well the vaccine is doing and what those side effects are, so we can educate people even more.
Mm-hmm.
And one other thing, I hear this all the time, and it's brought up. What if you want to this year take the Pfizer and then next year take the Moderna, or if you want to miss them, is it possible you can mismatch?
Right now, the study's out, and all we can do is tell you what has been approved, right? And it sounds like a script because that's what we have. That's what's been approved, is that we're not mixing the two vaccines, because the way they were able to get this emergency use authorization is based on the study guidelines that were presented to the FDA for approval. So it's Pfizer to Pfizer, Moderna to Moderna. I saw someone in the chat that someone said that Dr. Fauci said it's okay to mix. I have not seen any studies where they have mixed the two vaccines. So right now, the recommendation is you stick with that one product that you get.
Right.
You know how our cousins are. They like to mix the cherry with the grape Kool-Aid.
Right.
In some cases, it's okay, but until we have that data, we can't say that.
And it will, but with the flu, you get a different flu shot every year. You don't even think about it. Time you ask, right?
All we know is to get it.
Right. Exactly.
Right.
And to Dr. Washington,
can you help provide insight on the impact of the vaccine on people with heart conditions?
Mm-hmm. So I will tell you the worst cases, some of the worst cases I've seen in our healthcare system, and I'm with Methodist, are people that hit that second phase of the coronavirus infection and they have this inflammatory storm, right? So we're finding that a lot of the bad outcomes with COVID is due to underlying inflammation, and it affects the heart. So you see people with worsening of heart conditions if they have it, or very young people developing life-threatening coronary issues. We're seeing strokes, inflammatory processes in the brain. We're seeing blood clots in the lungs or in the legs due to inflammatory processes. So there's no restriction for anyone with cardiac disease. And those that are predisposed are actually, the older population or those with underlying healthcare conditions. That's why they're being prioritized for eligibility for the vaccine over someone who's young and healthy, because we know they may be at higher risk for poorer outcomes with a coronavirus infection. So again, top of the hour, talk with your healthcare provider to look at the nuances of you as an individual and your health conditions and the medications you're on. But there are no restrictions that I've seen for people specifically with heart conditions. Someone else asked as well, should persons with allergies, whether it be codeine or iodine or antibiotics like penicillins, should there be any concern with those patients being vaccinated? There's no allergy or severe allergic response that makes you ineligible for this vaccine other than severe anaphylaxis to the vaccine product that I'm aware of. The only reason we ask about your allergy history is it dictates whether we observe you for 15 minutes or 30 minutes. So we're not excluding people because they have a history of peanut allergy or penicillin allergy. We're just taking an extra cautious step of observing you for an additional 15 minutes.
Wow. A lot of great questions tonight. I'm also learning about this vaccine. So I know many people are just wondering, and I know we talked about this in the beginning, Pfizer, Moderna, 2 doses, Johnson & Johnson, 1 dose, and then you all hit on. Would you all say that was a low percentage of us folk that participated in these trials? I think that goes back into us just not feeling wishy-washy, and I'm saying us just being wishy-washy.
Yeah, Lynette, you want that one?
I could start off, and I know you have some strong comments about that as well.
Look, I'm sitting on my hands here.
So you saw on both of those, it was about 10% of people that of color, of Blacks, that participated in the trial. And some of that is our hesitation. But you will also see that 10% is actually a pretty good number. And we even had a large percentage of Blacks in the Memphis community that participated in the trial. There is a Black female doctor here in town that actually ran one of the studies, and you may have seen on the local news where they interviewed a couple of people that Black people that participated in the trial. So it might have been a small number, but it was a significant number for us to participate in. And we talk about the 95% effective rate and 72%, which is actually really good numbers for vaccines. The flu vaccine itself, it depends on the strain that we're attacking at that year, anywhere from 60% to 69%. Even the chickenpox vaccine is only about 85% effective.
Mm-hmm.
Wow.
Yeah. And I would just echo Dr. Washington's sentiment. Guys, we want data that's unique to us, but we can't give you data unique to us because we won't participate in trials. Half of us don't even go to the doctor. So Lord knows we can't get you to do, can I say Lord knows, Reverend Turner? We can't get you to go for an annual health exam, yet alone to volunteer to participate in a trial. But I do think times are changing, and we need to be part of the solution. So we need to participate more. We need to take advantage of opportunities like having the opportunity to be vaccinated, where all of the hindrances have been removed from the start. Again, we don't require you to have insurance. We're not asking for a copay. You don't have to have a certain income. So I think we're getting better in medicine and recognizing that, we're a country of many backgrounds and many statuses. So I think as we decide to participate more in trials, we will have more, minority specific data, but most of this data is probably from majority patients. And then also where the study's done, you also have to look at the percentage of minorities in that community. You're not going to have a high percentage of, Latinos or Asians or Blacks if they're not prevalent in that community where that study's being done, but we definitely can do better. But I agree, 10% is a huge start from where we were, where we didn't participate at all in studies in the past.
Yes, indeed. And then I'm gonna piggyback off of that because I do want to ask this question, and then we're gonna wrap up because we've been on here for about an hour or so, and I know folks like me have to go to bed and get up in the morning. But since this vaccine did come about real fast, and we got emergency use for the Moderna and the Pfizer. Johnson & Johnson is soon to be down the pipeline. And I believe I heard a physician say once before, this is the fastest any vaccine has ever been created. Can you all just hit on the timeline for the creation of these vaccines? Hit on the timeline.
Mm-hmm.
I will start, and then I'll let Dr. Howard jump in as well. So it may seem like it was quick, but there was some things that were going on before COVID-19 hit. So you guys have heard of SARS and MERS, right? So those are also COVID viruses. Those are that's part of the COVID family or coronavirus family. So there was already vaccine.
Rona got cousins.
Yeah.
Oh, wow.
And some of them are hiding in the cut too. So know that.
Yeah.
So there were already studies that were being done. So Dr. Corbett, that Dr. Howard mentioned at the beginning of the discussion, was already working on this technology, the mRNA technology, because of MERS and SARS. And also they were working on a vaccine for HIV. And so when COVID hit, which is a worldwide, it's a pandemic, that stopped those studies and said, we need to focus on coronavirus. So monies were thrown at the research to get this done. And the way that vaccines are made, usually you will do things like you do this step first, and then you do this step, and then you do the next step. With the COVID vaccine, they were able to do it in parallel so that it ran concurrently, and you could get approval quicker, not skipping any steps. All the same steps were taken. You could just do it quicker. Also, there is new technology now since we started developing new vaccines. How we look at data and how quickly computers can analyze data. So all of that information. So you had monies from everywhere being thrown at this. You had new technology, the infrastructure, because we had already started working on the vaccines with the other viruses, was already out there.
Yeah. So the analogy I use is I'm going to give you a ream of paper, which is 500 sheets. And and I tell you to cut each sheet in half, right? So you can take each sheet out and cut it in half, and then take the next sheet out and cut it in half. And it's going to take you far longer than if I gave you a paper cutter where you could take a big thick stack of paper and slice those sheets simultaneously. So when you do the steps together, you're still doing what you would have done, step 1, step 2, step 3, step 4, and then 15 years later, you have a vaccine and half the population's gone. Or you have different labs and different scientists and experts taking that technology from prior viral studies. And as Dr. Washington said, the Coronaviridae is the family of coronaviruses. COVID-19 is one of those viruses that caused the pandemic of 2019. But we use that I say God-given knowledge, because Lord knows where we would be right now if we didn't have all of those things already in play, and the Dr. Kizzy Corbett's of the world already working on how to take messenger RNA, that mRNA, and be able to replicate an infectious protein for us to quickly develop immunity in the matter of a month and a half. I mean, that's amazing. To me, that's a God-given gift, that if you can take it and you get educated and you're comfortable doing so, we should. But I think that's important to clarify, that this wasn't something done that skipped any steps. We just found a way to be more efficient, and efficiencies in medicine is good. It saves lives.
Yes, indeed. Yes, indeed. Look, we're gonna wrap up. We've been on here for an hour and 5 minutes, and look, I hope you enjoyed tonight. This great information. We have these two lovely ladies with all those degrees on the wall. I was thinking about placing my thank you, Lordy. Thank you, Lordy. I don't have that. Well, all those alphabets behind my name, but my thank you, Lordy, is going to go right here. But I want to thank you all for joining us. We had about more than 300 people join us tonight for this town hall meeting. That's awesome. Be sure to spread the word. This conversation, this town hall meeting, will be on the Boulevard's Facebook as well as the YouTube page, so you can go and share it as many times as you like to whomever you think needs to know this information, so we can clear up the myths and get educated about the vaccine, so we can keep everybody safe. And look, we heard Pastor Turner invite you, if you happen to be a visitor here on our live stream tonight, and you're a visitor to the Boulevard, we want to invite you every Sunday morning at 10:30 a.m. and 4 o'clock p.m. right here on the Boulevard's Facebook page as well as our YouTube page. And look, I'm not a pastor, but I'm sure Pastor Turner is praying for you right now. I wish we could have a benediction. I know the Lord is going to bless us. He blessed us tonight with all this information. So be sure to replay it. And I want to again thank the Boulevard family for allowing me to moderate this discussion. I want to thank Dr. Washington and Dr. Howard again. Great information. Hopefully all our cousins, nieces, and nephews learned a lot. So that be all. I bid you all a good night.
Bye.
Thank you for having us.
All right.
Good night. See you at the vaccine line this week.